Heart is a muscular organ which supplies blood to the entire body. It is a fist-sized organ which starts beating probably at 4th or 6th intrauterine life and continues till the end of one's life. This heart is supplied by coronary arteries which supply blood to the arteries which carry oxygen and other nutrients to keep the heart healthy. So how do you know the heart is healthy? Once one person starts exerting or exercising, the heart rate and the blood pressure should accelerate gradually. The moment he stops at the peak, the heart rate and blood pressure should decelerate or come down very rapidly, so much so that within first or second minute, the heart rate should come down to a normal pulse rate. This is an indicator of a normal heart, but sometimes it is not possible. Person will not be able to do it if reverse happens. That is, if the heart rate and blood pressure accelerates very fast at the beginning of the exercise and decelerate once the person stops exercising, it might be due to some cardiac problem or a heart problem. The common among heart problems is something called as coronary artery disease. This is a condition in which there are blocks in the coronary arteries called plaques. These plaques are nothing but cholesterol or LDL cholesterol, what we call as bad cholesterol, getting clogged in the heart blood vessels. The reason for the clogging are many, mainly patients with diabetes, with hypertension or family history of heart disease, or with blood high cholesterol, that is hypercholesterolemia, or in individuals who smoke. The incidence of this heart arteries getting clogged by the cholesterol is high. When this clogging occurs, patient is unable to exert to a normal level and causes chest discomfort at a certain point of exercise. This is what we call as unstable angina, or it's an indicator of heart disease. If these plaques break open in the heart arteries and there is a bleeding and a clot formation, the entire blood supply to the heart stops. This is a condition in which you call heart attack. So this is called as heart attack, and it's a medical emergency, has to be attended as early as possible. So is the heart attack the only problem of the heart? No, heart can be affected by many problems. Sometimes if the valvular diseases it can occur in a child in which we call it as congenital heart disease, in which there might be holes in the heart walls. It might affect the valves called as rheumatic heart diseases. In the valves of the heart are affected. The muscle of the heart itself can be weak, called as cardiomyopathies, in which the heart loses its efficacy of pumping. These are the various heart diseases. But due to the dramatic death which can occur to coronary artery diseases, and common in South Asians, the common incidence of coronary artery disease gives its importance. The ways to prevent this heart diseases are that if the patient has a diabetes, how do we know all chest pains are heart attack? The main cardinal symptoms of heart attacks are the patient has a big chest pain in the center of the chest, breathlessness or sweating. In this case, is all chest pains are due to heart attack? No, it's not so. The chest pain can be due to the disease of the esophagus, the disease of the lungs, or the muscular disease, or due to the nerves and bones. So how do we know the pain is due to the heart attack? As I said earlier, if the patient has the conditions like diabetes, hypertension, family history, or a smoker, if he has a chest pain which at the center of the heart and radiates to the neck or the inside of the left arm, it is mostly due to the heart attack. Such persons, if they have any heart problem or a heart burning on exertion, they should consult their physician and get the heart disease ruled out. But in a young person, a chest pain on the left side of the heart is not usually due to the heart attack. The heart attack pain usually at the center of the heart is either burning or wrenching or a stabbing like of pain or a burning type of pain which radiates to the neck. These are the symptoms of heart attack. Can a healthy person get a heart attack? Yes, even an apparently healthy gentleman can get a heart attack in which the patient has a plaque in the blood vessel going on since the beginning, which is undetected. One fine day, this plaque might rupture or open up and cause a heart attack. in other conditions, even if there is no plug, the coronary artery can dissect inside the artery itself, that is, the innermost layer of the artery can get separated from the rest of the artery, causing a blood clot and form a heart attack. So this heart attack, being a lethal most of the time, can it be prevented, is a moot question which most of my patients ask. It can be controlled. If a person, he should know his risk factors, that is he having a family history of heart disease, is he a hypertensive, is he a diabetic, or what are his cholesterol levels. So if these things are known to his patients, he should be in constant touch with his physicians and control these diseases, that is a regular taking of medicines, a regular diet plan should be followed, a regular health checkup should be done, and he should be physically active. By these measures, the risk factors leading to heart attack can be minimized, that is diabetes can be controlled, hypertension can be controlled, and smoking has to be stopped. So by this, the risk of heart attack can be brought down. So or else, even if the heart attack occurs, it might be in a milder form. Once the heart attack occurs, most of the patients gets dejected and feel that this is the end of the life. No, it isn't. Then intelligent living can be leading to we can have a productive, good life even after a heart attack. That is by following adequate medications, by adequate treatment, and following the doctor's advice, having a good diet plan and a physical activity, exercise, you can have a normal life, not even a near normal life, but an absolutely normal life even after a heart attack. So patients who have got heart attack need not be dejected. So in conclusion, what I would like to add is, heart is a muscular organ which has to be looked after. You have a good diet plan, have a good health checkup, and control the risk factors you have got, and you can have a healthy heart. You have got only one heart and one life. Look after your heart and it will serve you for life. Thank you.